Primary Care Initiative is a program that we began at Keck in the fall of 2011 with the idea of being that we wanted to increase the number of graduates who go into primary care careers when they're done. Primary care careers being family physicians, general internists, general pediatricians, and geriatric physicians.
We do try to run this program as a family unit, so we create a environment where we are supportive of each other, but we also challenge each other intellectually.
What it does is that it really helps to develop those skills necessary for primary care and also highlight the importance of primary care. And one of the biggest ways they've done that is when we go once a month to a primary care clinic.
So I feel that having the primary care tract, students get from the very beginning to see what it's like to be in an office and actually be a primary care doctor. You know, most primary care doctors are not in the hospital, which is where most of them are doing their ICM and their training for the first couple of years. So they get to see how that is and what it's like to work with a doctor who's doing that all the time.
I mean, it's really inspired me to do work in urban underserved. That's the environment that I've been looking for when I go forth and look at different residencies. Mostly because I think that relationship that you develop with some of these patients who come in sometimes once every year or once every 6 months is really important.
What I feel from this program is that there's a constant drive to want to be better, to want to reach more and more people, to have more questions, more of the students' questions answered. And so it's encouraging to see that there's so much of a push for primary care, because it makes me feel that what I'm about to do is very important.
Just the mentors that come with this program, again, you know, they are such role models for what we could become and what we could be.
And we were never short of experiences. You know, I think some students did like backpack medicine in downtown LA with like the homeless. There's also like tattoo removal. So it's, I mean, the primary care spectrum is so wide that she was always like, if you want to do this, here it is. So never short of experiences.
The best way that the primary care program really fosters a community is by plugging you in with a cohort of like-minded students interested in primary care, interested in filling the gaps in the primary care system, really kind of working with the hardest and most complicated patients in our communities, and to work with those other medical students and side by side, and to go through med school year by year with them is one of my favorite parts of med school.
The lunch talks are really great. We always have a panel of doctors at each of them, and so it's having doctors from either the same specialty but practicing in different settings, or having different doctors from different specialties come and having them all in one place is really awesome, because you get to just hear all the different perspectives all at one time.
I've done research in end-of-life care for geriatric Latino patients, and I think this program has really helped connect me with mentors in the community, helped connect me with geriatricians in the community.
So IPGC, you work with elderly patients. You actually get to go to their homes, which is really interesting. You learn a lot just by sort of seeing how they live. It just lets you see another aspect of someone's life. But I would say even more important than that, in IPGC you're paired up with physician assistant students, dental students, pharmacy students, occupational therapy, physical therapy, and you work as a team.
I really love the primary care program, everything that it has to offer, from all the resources, from the mentorship, from Dr. Riley, Dr. Mosqueda, from Jose, all of the extra programming that they do is fantastic.